Hi, everyone. We're here today to present DocuMentors. I'm Dr. Ivy Peltz.
And I'm Dr. Eric Studley.
And we're here to talk about what to look for in an employment contract. So we have a couple of disclaimers this evening before we get started. Disclaimer number one is that this evening we are giving you the viewpoints and opinions of Drs. Peltz and Studley, and we recommend that you consult with an attorney before you sign any contract. So that is disclaimer number one. Disclaimer number two, well, we're assuming many of you are still students, so you haven't attended that many continuing ed courses, but they usually start with a disclaimer that says something like, we are not representing any product and we do not gain from any product, and we would like to let you know right off the bat that we are representing a product and we would like to talk about our product while we educate you. So our product, of course, is Doccupations. We match dental job seekers with dental employers, and it's all about you. We have created this to help you get jobs. But in the meantime, today we're going to talk about what to look for in a dental employment contract.
And if you do have any questions, please, send them to us.
Message us.
And
I'm manning the message center.
Right. So your questions really help drive us, and they're probably the same questions that everybody else has. So, especially this time of year, so many of you might have already started looking at employment contracts or starting to consider this type of thing. It is real important that you start doing your background, your research, your homework. You should go online, start looking up employment contracts for dentistry, because employment contracts for dentistry are very different than they are for the medical profession, for the legal profession, for any other profession. So like we have terminology for ourselves in the dental world, there's the same type of terminology that goes on in employment contracts. So I need you to be somewhat versed so that when you do at least look at these employment contracts, and if you do speak with an advisor, you are aware, you have an understanding of what they're talking about.
So Dr. Studley just said, if you speak to an advisor, and we'd like to reiterate that you absolutely must speak to an advisor before you ever sign a contract, because your eyes are not skilled. You don't have the skill to read a contract carefully enough. However, we also recommend that the first thing you do when you get a contract is read it, because we know that many of you don't even really look at things before you sign them. So when you are signing anything, it's an agreement between you and another person, and you need to read that agreement before you put your name to it, because once you do, it's a legally binding document.
Right, because how often do we find, even with employment contracts, with insurance plans, people become experts at time of claim. People become experts about their employment contracts when they're not getting paid properly, or they want to break the contract. Then all of a sudden they're paying close attention to all those little details that they didn't. Also, once you sign on the dotted line, you cannot make any changes.
So Jay Choi just asked if we could talk a little bit about a restrictive covenant, and yes, we're definitely going to get to that, so please stay tuned.
Right, Jay, hang in there, I promise we'll get to it.
Bruce is asking if we need a special attorney who understands dental contracts, and absolutely that is a plus. We're going to get to that too.
Right, because there are specialists in all different professions that specialize in that, like accounting, like insurance. There are attorneys that really specialize in the employment contracts with dentists, because as I said, it is another language. So some of the things that we'll talk about, because we can talk about employment contracts for hours, we're just going to pick some of the main points that I find that my clients, my students really bring up. And these are things that you should focus on right off the bat. So one of the first things you get when you do get a contract, it's a term, meaning how long is this contract going to go on for? I recently saw a contract that, number one, it stated that it was going to go on for 3 years.
So is that a good thing or a bad thing? Do they want a long contract or do they want a short contract?
Well, what would you think? I would want a shorter contract because then, number one, if I need to get out of the contract, it's easier to get out of the contract. Number two, if the contract renews at a shorter period of time and I am up for a review for a raise, I would want that contract to renew. So on average, in my opinion, you should have a yearly renewable contract so that at the end of the year, you can then renegotiate for higher fees. Or as you're approaching the end of that year, depending on the contract, you may have to give notice a certain period before the end of that year, before the contract renews. So that'll give you the ability to get out of the job within the year.
Mm.
And
what about those who need sponsorship?
If you need a sponsorship, most of the sponsorship contracts require a 2-year contract in order to receive the full sponsorship. But it's very important that when you do sign a contract for citizenship sponsorship, that is listed in the contract, that it states that they will be sponsoring you. You want a start date as far as when the sponsorship will start, and you would also like included in the contract that the employer will be covering the attorney fees for the sponsorship, which can be thousands of dollars.
So I remember that when I started, I didn't know. I was getting questions like, did I want to be an employee or was I going to be an independent contractor? And I had no idea what any of that meant.
Mm-hmm. So there are so many different ways that you can be considered. So we have what you can be called an employee, or what they also call an independent contractor, or another term for that would be an at-will. As an employee, they will be taking out taxes, and you might be eligible for certain benefits that are given in the practice. As an independent contractor, you might be part-time or even still full-time, but you have a little bit more, or at least you should have a little bit more flexibility in the contract. But what I'm seeing, that a lot of the employment contracts are treating the employee and independent contractor pretty much the same way contractually, but financially, the independent contractor may be responsible to pay their own taxes. So that if you are an independent contractor and receiving a 1099 and not a W-2, then you must pay estimated taxes. You need to meet with an accountant that is also versed with, that are versed with dentists, and they will set up estimated taxes. I know myself as a new dentist, my first year, I put away a couple of dollars every month to pay taxes, and then in March of the end of my first fiscal year, I talked to an accountant and he tells me I owe so much more money than I was prepared to pay.
And my experience was even worse. I think we talk about this in every single Documenters, which just shows how traumatic it was for both of us.
Yes.
But I had no idea I was going to have to pay taxes. I had never really worked before, and I didn't know what that meant. So I did not put aside a few dollars every month. And I eventually had to borrow money to pay my taxes that first year. So be warned, there are taxes to pay, which brings me to a question from Kieran that I'm going to let Dr. Studley answer, but before I do, I want to make a comment. So the question is, do we have any recommendations for dental attorneys? Someone who helps recent graduates. I contacted some and they charge about $300 an hour. And what I want to say before Dr. Studley answers that is, when you get out of dental school, just as we, just told you about our independent, naive experiences that we had with taxes, you're in the mentality of a student still. But we all have to pay for services. And the services of an attorney are very badly needed in situations like this, just like the services of a dentist are very badly needed when they are, and patients often pay very dearly for that. If you want to get good advice, sometimes you do have to pay for that. So So also be warned, don't necessarily go to the friend who just graduated from some program and is going to read this for you for free. You may want somebody with some solid experience who may charge a little more, but the advice will be more sound.
And, I can't agree more. After being in this type of advisory business, I have found countless times with my clients, with myself as well, when I was first starting out and buying a practice, selling a practice. Sometimes, well, I shouldn't say sometimes, I would say all the time, if you use someone who is not as versed and maybe less dollars per hour, I'm almost willing to guarantee that it'll cost you more money in the long run, because someone will have to spend more time actually learning on your dime. So using someone who might have a certain cost, especially if they have the right name in the industry, I think they're well worth it. And if they're charging that, I would pay that kind of money. We do have a lot of professionals that we work with that write blogs for us on our career advice site.
That's true. Go to our blog segment and you'll see some attorneys who have that focus. So what else should we talk about with employment contracts?
Well, some of the things that should be listed are services. Services meaning what is expected of you, right? What is required of you? Countless times I have received phone calls from new dentists who are working in certain practices where the areas of expertise that are expected of them are well beyond their scope at this point. Yet they feel pressured to go in and do these procedures, and unfortunately, they don't come out right.
Yeah.
And that creates, number one, a very bad situation for the patient, for yourself, and a lot of times it's created termination of jobs, and to take it to the furthest extent, negligence or malpractice cases.
Would you say that as a rule of thumb, a practitioner should never do anything that they feel uncomfortable with?
They should never do anything that they're uncomfortable with, because even when you work for someone and you're instructed to go and do a certain procedure, it's still you that is doing the procedure.
Right.
So nobody can make you do any certain procedure. So it would make you much more comfortable to know what services are required of you. Are they going to require that you do molar endo, second molars? Maybe you're not good at that. Are they requiring that you extract impacted, teeth? And that may not be something that you're good with. Do you have to do apicos? Do you have to place implants? All these things, because then you're going to end up wasting your time if you end up getting the job, because you won't be able to really work to the right capacity. You'll feel the pressure, the anxiety, and it's just not the way you want to do your dentistry. So knowing the procedures that are required of you up front will also let you know that this is the right fit for you.
So I also want to throw in that for those of you who have not worked in the dental profession before, everything's going to feel a little bit overwhelming. So you have to be able to distinguish between what should feel overwhelming and what that you're just out of your element. So if you feel completely out of your element, then you probably shouldn't be doing anything.
Right. And, once again, with all the fallbacks, all of us, including Dr. Peltz and myself, we went to dental school at one time and we had mentors. And I remember through my beginning years of practicing, calling some of my professors, and going over certain things with them, and they would tell me, what's right and what's wrong. And I think that for those of you that have the mentors that are out there, call us.
Yeah, so everyone call Dr. Stover.
All right, so call me. You don't even have to give your name. All right, you could just be Dr. X. But it's always good to have that mentor. Also, one of the things that I see in contracts is that I recently saw that it stated that the dentist will practice the type of dentistry that they perform in their office. So I asked the dentist, who unfortunately did not sign the contract yet, if they can get a listing of like what type of dentistry are they talking about.
Mm-hmm.
And some of the things that they were talking about, no need for me to bring up, but it's things that I would never perform on my patients. It's things that we don't teach in the dental school. It's things that I never performed in my own office, and I'm sure that you never would.
So the work should be the standard of care.
Exactly.
And only procedures that the American Dental Association would approve.
And that's what should be listed in there under services, that the practice will maintain the code of ethics and the standard of care of the American Dental Association. It's that all their procedures are ADA approved, all their materials. These are just things I know for a lot of you that you're new and fresh and you think these are taken for granted. But in reality, we wouldn't have so much to talk about if these weren't the things that were going on.
It's true.
One of the other things that's important when you sign this under your services, your work schedule. That could work two ways. Most of you want a full-time position. You relocate, you move your families, you set up a new life in a different state. And then you get there and you find out that they're only able to give you 2 days a week. And now you're, foraging for another job somewhere. That's where, fortunately, there's a good commercial time.
Doccupations. So should you find yourself in that sort of position where you need to fill in a few days unexpectedly, well, we know exactly where to go. www.doccupations.com.
So, we would prefer that not happen to you, that you really set everything up properly so that when you are going, to this new location, so that's why you want, if you're going to sign that contract, because most of the things in this contract are going to be in favor of the employer, not the employee yourself. So you need to have control over certain things so that if they are promising you 4 or 5 days a week of work, and you want that in the contract so that when you do relocate, you know that you will be able to make a living and pay your bills when you move your entire life to a new location.
We have a question. How do you balance doing new procedures that are up and coming, like implant dentistry, while not pushing so far out of your comfort zone to do negligent dentistry? So is implant dentistry still up and coming? I thought it
right.
Up and came.
Right.
Yeah.
Implant as far as that, but let's
accepted. That's an accepted procedure at this point. So I think we're
completely.
talking about things that are pushing the envelope in terms of.
Right, but if it's out of your comfort zone, right?
True.
Then I, as a teacher for a gazillion years, it's having that D3 student who may know how to do the procedure on paper.
Right.
Knows all the evidence based about the procedure, but can't actually do the procedure in the oral cavity.
Right. So now, in addition to plugging ourselves, I'm going to plug continuing education.
Right.
Because if you're not comfortable, then you really need to take some hands-on continuing education courses until you are comfortable. Because you're always going to have a first time doing something, and that will always feel uncomfortable, but you need to have enough experience behind you so that you're not so uncomfortable that you could cause your patient harm.
Also, in a lot of the employment contracts, I see continuing education courses. Some of the practices actually have their own continuing education courses for all the doctors in the practice. Mm-hmm. A lot of the corporate companies now have their own continuing education, or a lot of them will give you, let's say, $1,500 towards continuing education. Now is the time. You're out of dental school. Take the parts of dentistry that you are weak at. And if implants are procedures that you're weak, those are the courses that you should take, not the easy ones to get a couple of quick credits.
Exactly. It's sort of like working out. You know how you don't mind working out the strong parts of your body? Well, this is the exact same thing. So yeah, continuing education. We're big fans. Lifelong education.
Yes, time to work
Lifelong
the
learning.
abs. Work the abs.
Work the abs.
So, next part of our, and thank you so much for a lot of these questions.
Yeah.
Next part of the contract that becomes the heavy meat is the compensation. And that, for some of the contracts, I actually feel for so many of you, because when I read some of these formulas, how they will pay you, you almost have to be an actuary to figure it out, because I've only been doing this 30 some odd years. And when I have trouble figuring out how you're going to get paid, I'm nervous. So my first rule of thumb is, if it's that difficult and it takes about 2 pages to explain your compensation, or in my world, in Studley world, that's not good. I also feel that do not fall prey to some of these contracts that give you these big bonuses when you hit certain numbers, especially as a new practitioner. You do not need the added pressure to hit certain benchmarks right away to make certain dollars. So in signing a contract, you want to try to get the greatest per diem guarantee that you can for the longest period of time. I see some compensation start out with a certain package at 1 month, another package at 3 months, and then from there. Usually they give you more of a guarantee the first month, lower it the next 3 months, and then reduce it to total collection in month 6 and on. If you have your wish list, try to get a guarantee number 1 forever, or try to get the guaranteed pay against the percentage for as long as possible as well. I also like that if a dentist will give you a guarantee per day against a percentage, that means that they have a busy office and they will be able to keep you busy. If you're going to spend 8 hours plus in a day, you want to make a reasonable salary. So if somebody's going to guarantee you a certain dollar amount for that day, we're pretty much, sure that they're going to give you enough patients to make that amount.
So Dr. Studley mentioned a wish list, and I know today we're talking about the important parts of an employment contract, but I wanted to talk a little bit about a wish list and just the parts leading up to getting to that contract, because I just want to mention 2 important things. The wish list is just a list that you make of everything you'd like to see in the contract. Mm-hmm. And you probably won't get everything. In fact, it's highly unlikely that you will. But the other thing I want to mention is that this is going to be your one chance to negotiate, or to negotiate hard. So you want to put everything into your wish list that you would want to see included in a contract. And then you do need to be prepared to negotiate when it gets time to talk about this contract. So we've had a couple of questions, actually. Ken would like to know, would CEs be enough adequate training, or should one pursue formal training? And I think that depends entirely on what it is that you're trying to learn how to do. So if it's different armamentarium for a new procedure, for an old procedure, then maybe just a CE course might be enough. If you're learning how to place implants, I would highly recommend a formal training program. So I think it depends on the level of degree of expertise or the jump that it takes between your current knowledge to what it is that you're trying to learn. And then Sophie, hi Sophie, has asked, if your compensation includes % of collections, how can you as an employee track collections to make sure you're being compensated fairly? And I remember when I was in that position, I would, at the end of the day, I'd have a running list of what I did all day, every day, a day sheet that I believe I had to fill in as part of my day. So you're doing the dentistry, you're writing the patient records, and filling in your day sheet. I'm sure there are much more sophisticated ways of tracking this now.
Right. And, this does tie into the compensation, but if you work for any legitimate employer, and whether it's dentistry, insurance, It really doesn't matter what profession. You should be receiving, first of all, compensation. It should also be listed in your contract when you're getting paid. You should never sign a contract where you're only getting paid once a month. That it makes your accounting ridiculous, and it's very difficult for you to get any kind of cash flow, especially as a young dentist. So you should be paid no less than twice a month. That is standard in the industry, like the 1st and the 15th is standard. So Sophie, like someone like yourself who's working on collections, when you get paid, you should be receiving a daily printout so that when you get paid, you see a full printout. Look, I have an insurance brokerage company. I get commission checks from insurance companies all over the country. I get a full printout of every single name, percentages. You should be getting no different. And they have the software if they're using anything.
So, for those of you who were our students and had to track things and were so miserable about it all the time, it gets very real when there's a dollar sign at the end of it. And for those of you who were my students, you might remember me telling you at the time that this goes on throughout your professional career. So there it is. You have work to do. Unfortunately, that's just the way it is. So what I would recommend is that you take that daily sheet and review it daily while your memory is still fresh, because it gets very hard to try to contest an omission in your day sheet, your daily sheet, whatever it's called, right. If you don't remember it clearly. So I would review it every single day. It's your responsibility. It's your obligation to yourself.
Learn your codes.
Yeah.
Really?
So Jay would like to know, when do you usually renegotiate the initial compensation, 6 months or a year?
Well, if in your contract, if you can get it to be put in the contract that we will renegotiate in 6 months, but most of the time they'll do that's why I would like a contract to be a yearly renewable, a 1 year, so that you can renegotiate at the 1 year point. Okay. So when we start talking about compensation, how much am I supposed to get paid? And we have so many different types of terminology that we'll touch on. A lot of the corporates will give you a per diem. Very few will give you an upfront type salary, or they'll give you a salary, and let's say it's $150,000, and they'll take that $150,000 and break it up into a 12-month period, and that will be your salary. They may put it against a certain percentage, so that if you produce, let's say, more than, I saw a contract recently, it was $150,000 salary, but if the dentist produced more than $600,000 gross, they then got another certain percentage above that number. So you may see a salary, you may see a per diem, which means per day. You may see something anywhere from 400 per day to 1,000 a day. If you're a specialist, it could be even more. On average, throughout the country, I'm seeing approximately 500 a day as far as a guarantee. As far as percentage-wise, on average, I'm seeing 30% against collection, not production. If you can get 30% production, that's better. That means you produce the dentistry, whether the patient, the insurance company paid or not, you're getting paid. If you're getting paid on collection, that's why it's very important that you have a guarantee. Otherwise, you have to wait to collect your money while the patients pay or the insurance companies pay. Which is unfortunate, because the collection piece is not even within your control. So that's a bit of right. So that's why you want to, get that kind of thing. Also, in your compensation, you want to find out, are you responsible for lab fees? Some of the offices, they use their own labs, so the lab fee is already included in your paycheck. Some offices, if you're 30% of collection, they deduct 30% of the lab fee. I worked one office where they took 100% of the lab fee came off of my end. And a lot of times the contracts are vague, aren't they? Yes. So you really have to ask, what are some of the deductions? Something also, before we go on to the next part, a lot of times you guys will say, well, I am getting paid on production, look, it says net production. Net production is just another term for collection.
Listen carefully.
All right, so net production just means what the production is minus what was actually received, which then is another term for collection.
Tricky, tricky.
All right, so you most likely, a lot of times, will see net production, not collection. Please be aware.
Mm-hmm.
So some of the offices that you will work in, they will build into the contracts and they'll say, we'll give you insurance benefits. If you will be working for a DSO, most of them, because I know I insure a lot of the DSOs for malpractice and disability insurance, you have to get the malpractice through the DSO because they are a much larger organization and individual malpractice companies won't cover you there. So that's why make sure that you negotiate that they will pay, and I'm seeing on average about $1,000 for the first year towards the malpractice insurance. Some of the companies may offer disability insurance. With malpractice insurance and disability insurance, most of the companies, if they do offer those benefits may not be portable, which means you may take out your disability insurance. Let's say you had your disability insurance with Dr. Studley, and then you go work for a corporation that gives disability benefits, but it's not portable. You keep that for 1 year. Now you leave that company, now you have no disability benefits. So it's very important before you drop benefits or take benefits, consider the portability. Can I move the insurance that I have with me? Malpractice insurance, 2 types, claims made and occurrence. Most offices give you claims made. I recommend occurrence. That means the tail's included. If you do work for a DSO or anyone has a claims made policy and now you leave, you must purchase a tail. Otherwise, you will be personally liable.
So a tail
will cover you for anything that you did prior to on any patient.
So in other words, you leave your job and you have had a claims made policy, and after you leave, someone makes a claim against you. If you don't purchase a tail, you will not have coverage for that event.
Right, so correct. And those are usually in the contract where it states that you, the employee, is responsible for purchasing the tail. If you are fortunate enough to have an occurrence policy, some of the DSOs that I insure, we have occurrence policies. You leave, the tail's already included, you're safe to go.
Right, so the occurrence includes the tail. You don't have to purchase it at the end. And they can be costly, can't they, a tail?
Right, it goes by the amount of years
Right.
and where you've been practicing.
So if you're working for a DSO and they will give you a claims made policy, can you pay the difference for an occurrence?
Sometimes you can.
So that would be something you might want to
it's something you want
negotiate
to
into
ask.
the contract. We've had a question from Eunice. As a new grad, which is a better way to start your career, corporate, private, or community health, or just go on to another formal education? That's a very private decision. I don't mean private that you can't talk about it with people. I mean personal. Personal is the word I mean.
Right.
Because I could go on with my education forever. If I didn't need to make a living, I think I just would have stayed in school for the whole entire rest of my life. That's me. Dr. Studley, he loves to work, so, you know.
Right,
but you want to address this question a little more
I
than
think,
that?
you know, and not making a commercial again for Doccupations, but I think, didn't we write something about
Yes,
like
we
where
absolutely did. So
and then we also
talk
have
about,
stuff,
we have, actually our
yeah.
next DocuMentors is called Corporate or Private Dentistry, I believe. I don't remember the date offhand, but you can see it listed in our events, so please make sure to tune in.
But I think
and
also
as part of the profile completion for Doccupations, you need to think these things through.
Mm-hmm.
So part of what we designed into your creation of your profile was the necessity for you to have to make these types of decisions, because you'll never make the decision until you really start considering it and thinking about it and asking people questions. And, you know, based on what you hear from each person that you ask, that's going to help you form your opinion too. Because ask like-minded people what they enjoy the most.
Mm-hmm.
That's a good way to figure it out.
It is. And it's also not just an individual decision. It's a family decision.
Right.
It's a group decision.
Sure.
It's a life decision.
Yeah.
You know, the one great thing though, Eunice, that dental license gives you so many more states now that you really could look at so many parameters in one state. That will it give you, if you're into community health, will it give you the community health? Will it give you the place for you to live? If you want a family, a good place to make a living, a great place to live. You know, really have so many things. And I have to tell you, I'm a little jealous because just the fact that you have these opportunities now, that's pretty cool.
So thank you, Devin. We got a really nice Doccupations plug.
How are you, Devin? So in continuing with some of these insurance benefits, some of them will also give you retirement plans, but also make sure, once again, about the vesting. And what vesting means is you may work for somebody, they give you the opportunity to put money into a retirement plan, but if you leave short of a certain period of time, like let's say it says you have to stay there X number of years before you could take 100% with you, then if you know that you're not going to stay there for that full length of time, you can still set up a retirement plan, but you may want to set up something that's more individual, that you own, that you could take with you wherever you go. Okay?
Do we talk about start dates and end dates? Because I'm just thinking about some students.
Right,
you know.
That's true. When we started to talk about that start date. So for new grads, new residents finishing, you know, when are you going to get your license? So you want to give the employer as well as yourself some flexibility that you will start on or about a certain date. And what I'm seeing is it'll state that, you know, they'll say July 15th or 2 weeks on or about within the period of time that you receive your licensure. Mm-hmm. Also, if you are working for a DSO type of contract, it usually takes about 6 weeks to get fully credentialed. All right, so that you have to put that into play if you're relocating, so that you could work your finances. And that's where you should maybe negotiate a sign-on or a moving bonus when you are negotiating your contract. And
if they wind up being late to their start date, isn't there often a hefty financial?
Yes, it's almost the same type of termination. You have to give that same 90 days notice or whatever might be in there. And there usually are stiff penalties if you just break the contract and don't show up.
And usually in what I've seen is you don't have 90 days because you guys are signing contracts that start pretty shortly after you graduate. Mm-hmm. And then it takes longer than you expected to get your license. And now you wind up owing your company money before you even start.
Right. So you have to go through state licensure, all right, when you guys relocate. Depending on the states, you need your own Medicaid provider number. If you work in a dental office that accepts dental insurance, you need your own provider number, NPI number, DEA number. Please never give out the use of your provider numbers. First of all, that's fraud. And number two, anybody that wants access to your numbers is not someone that you would really want to work with. You must have your own provider number so that if you work for a dentist, they will need your provider number to bill out simply for the procedure that you did as the provider.
So we have a very hypothetical question. What is a reasonable start date for someone who is finishing residency on June 30th and applying for a New York State license, hypothetically speaking?
Right. Hypothetically speaking, you're looking at about mid to the end of August.
Wow. Okay,
All right.
did you know it was going to be that long?
Well, because
I
they
didn't.
finished the program June 30th,
Right.
and now they start filing the paperwork.
Yeah.
And what I've seen in the past, and it's gotten a lot faster, but I'm seeing like mid-August.
Yeah, I remember when we graduated, it was till September. Everything took longer then. And also I'm going to just throw in again, if you're asked to do a working interview, please do not do that without having a license and having malpractice insurance. You need both.
Right. You cannot do a working interview under somebody else's dental license. You cannot do a working interview under somebody else's malpractice insurance. You cannot also do a working interview, and I've heard this where the dentist has said to the new dentist, well, you're just doing a prophy. That's like a hygienist. Well, guess what? Now you're not even a licensed hygienist. So maybe the only license you might have is a driver's license at this point. And that really doesn't give you the right to clean somebody's teeth.
Nope.
So please, you want to start on the right foot and starting out doing things like that. Just to let you know, if you need malpractice insurance, working interview, first year dentist, malpractice, we can get within a couple of hours to like 1 day tops. So you can go on an interview on Monday and we can have you with malpractice Monday evening and you could start working Tuesday morning. So there really is no excuse for the other dentists to say, you don't need that. So please, you must have that. Also in the contracts, one of the things that you will see is termination. So as I said, the contracts are always written in favor of the employer. And when it comes to termination, it goes the same way. You as the employee, some contracts will state that you have to give 30 days, 60 days, 90 days. I've seen 120 days. I saw a contract that said they could not give notice until after working 1 year. So in essence, it was a 1 year notice to quit. Okay? Be very aware of these. Somebody that can put in their contract, they could state whatever they want. People say, Dr. Lee, is that fair? No, it's not fair. Then don't sign it. All right? But they could still put in whatever they want. Also, I have seen dollar values attached. So for example, I see contracts where it says you have to give a 90-day notice if you want to terminate the contract. So you work for me, for example, and you tell me 90 days from now, I am quitting. And I said, that's great. So 90 days, as they start to count, after 30 days, you say, you know what, I don't want to work here anymore. So you leave. The contract stated that you owe me $500 per day for every day short of the 90 you stay. So you quit, you owe me 60 days still, I send you a bill for $30,000. That's what it cost you to quit.
Ouch.
Yes, very expensive. You signed it. So you want to fight it, you got to get lawyers, and then you also have to get lawyers in the state that you worked in. So you may not even be in that location anymore, and you have to get an attorney in that state. Quite costly. So an employer can fire you for any reason, for no cause, with no notice. You would have to give notice. As an independent contractor or at will, one of the things in those contracts, a lot of times you don't have to give notice, or it'll say 2 weeks notice or 30 days notice. As a professional, you should give the proper notice that is necessary for you to take the proper care of your patients. Because whatever goes on between you and your employer should not go on between you and your patient. So always keep that in mind.
Ready to talk about restrictive covenants?
Restrictive covenants, yes. This is something that everybody is always like the biggest, meatiest part of that contract. And it's one of the things that so often everybody used to say, oh, don't worry about the restrictive covenant, it's not enforceable. Well, number one, anything that you sign on a contract is 100% enforceable. Whether it is or not, and it has to be brought to a court to see if it is, you don't want to. It's not your job to find out if this was a valid contract. You signed it. Everything that you signed in there, you have to go along the premise that it is valid. Otherwise, it'll cost you a fortune to fight it. So
just while we're still on that contract
Mhm.
piece, I see a lot of people have joined us late. We do want to emphasize that in any case, you really must have your contract read by an attorney.
Mhm.
In addition, please read the contract yourself. We've both been in situations where we've had attorneys read the contract but miss things that we picked up on our own because it's affecting you. And you're the one who's most interested, and you're the one who knows what's appropriate and what isn't appropriate. So you have to read it yourself, make sure that it's something that you want to sign, and then have an attorney read it to make sure that there's nothing that you missed or that you shouldn't be signing.
Right. And sometimes that couple $100 for an attorney to review an employment contract for an hour or two is most likely the least amount of money that you would have to spend
Right.
If there was a problem.
Yes.
And that's just one thing you don't want to have to deal with. If we could ever keep you away from that, that would be one of the best things that we have been able to teach you guys.
Yeah.
So the restrictive covenant is a part of every employment contract. That's why, as a dentist, if you have an opportunity, you work for a dentist and they don't give you an employment contract, that's fine. You can get away with what we call an agreement. You could simply state in the agreement, "Honey, Dr. Steldy, it was great meeting with you. Just want to go over the 5 points that we discussed, and it'll be when you're getting paid, how I'll pay you, the percentage, a couple of the different really solid points." And it's like, there we go. And you get confirmation from me that it was like, great, can't wait to see you on Tuesday, and we're good to go. If you ask me,
So would that be legally binding?
yes, okay, because we have an agreement and it's stated, right?
Mhm.
We've seen things people have signed on napkins
Yes.
that have been legally binding,
Yes, we have.
okay? So if you ask the employer for the whole employment contract, they're going to come up with one, but then everything in there is more or less going to be in their favor. And the restrictive covenant is one of those things. And that simply means it's a distance from where you cannot work for a certain period of time. It is also a distance and time where you cannot solicit any of my patients or any of my staff or any of my trade secrets or any of the companies, vendors, people that I have worked with within a certain distance of time as well, including the personnel. The restrictive covenant, depending where you are, in rural areas, they could be 1 to 2 years, they could be 10 miles, 15 miles, 20 miles. In some rural areas, 20 miles, I have said, oh my God, that's ridiculous. And you'll say, really, 20 miles? There's nothing for the next 40. So 20 miles there is not a problem. I've seen in Manhattan, in an urban area, where they go by blocks, because if you want to just practice in Manhattan for the rest of your career, and you get, a 4-mile radius in Manhattan, I think that puts you into the Bronx.
It's the island.
Right.
It's the entire island of Manhattan.
Right. So, you really want to pay attention to those restrictive covenants. You don't want to have to litigate the restrictive covenant. Very, very important that way. If you can negotiate the restrictive covenant, which I highly recommend, in my world, I would like a restrictive covenant to kick in 1 year after you are working somewhere. That's totally in your favor. Because this way, if you leave the job, there's nothing against you. So if you could try to negotiate a restrictive covenant where it's 1 year, 1 mile, for every year you do, you get a mile, that's pretty fair. I've seen them where they kick in after 6 months, after 3 months. Try to negotiate where the restrictive covenant can kick in as far away as possible.
Shazad has a great question. Hi, Shazad. He wants to know, if somebody works for multiple locations, how does it work with the restrictive covenant?
And I was just going to get to that. Thank you so much. So what I see in contracts, especially now, so many dentists own so many offices. And I just saw a contract where the dentist, they own 8 offices, and they had a 5-mile restrictive covenant from each office. It pretty much put the dentist, I think, in Bulgaria was where he would be able to practice if he left. And guess what?
I think we just got a like for Bulgaria.
Oh, there you go. And guess what? We were able to get that restrictive covenant from 5 miles from one location. So sometimes there might be stuff in that contract that the other side is going after, and if you're silly enough to sign it blindly, they're the ones laughing in the back room going, I can't believe what they signed. Now this guy can't even work in our state. So you want to make sure if you're working in multiple locations, it must be listed in the contract that your restrictive covenant is only from the one location that you work the most amount of hours, period. Okay?
So since we're talking about contracts and how they're binding and writing on a napkin, I think I'm going to talk about my grandparents for a moment, because my grandfather he was a partner in a parking garage on 57th Street in Manhattan. So for those of you who are not familiar with Manhattan, that is very, very highly priced real estate. And he went away for a week. Oh, he was engaged to his partner's sister. I forgot to mention that. Went away for the weekend, met my grandmother. He went back to his parking garage and he took the money in the cash register and wrote a note that he left in the cash register that said, I've taken the money in the cash register. This is good for my half of the business. And then went on to live unhappily ever after with my grandmother. When he tried to sue for his half of the business years later, that note that he left in the cash register was legally binding. So be very careful what you sign.
It only cost $1 million.
Yeah, well, yes. So these are just some of the provisions of a contract. Every contract is different, and every company has a different contract, and every state has different laws, and you should definitely consult an attorney before signing anything. We've been really happy to spend this almost hour with all of you. Very happy to see some old friends and some current friends. And you see Dr. Studley trimmed his beard a little bit. It looks beautiful.
Thank you.
We'll see you again next month.
Thanks, guys. See you next month.
Bye.
Bye.